Hey guys, I just wanted to make a quick video to talk about the day of my surgery and my hospital stay and what's been going on since I got home. My surgery was 11:20. Everything went great. Had to be there really early in the morning, like 5:15. They took me back about 7 to the holding area. Started a drip. The don't care is what I call it, medicine. And then they took me on back. I talked to the anesthesiologist. He comforted me with any fears that I might have, and he was really nice. And they put me to sleep, did the procedure. They contacted my family while I was back there and let them know what was happening, and everything was going good. Got to recovery. I had a little bit of a strange stay, I'll just say, while I was in the hospital. The hospital that I had my procedure done at ran out of rooms. They were completely booked. So there were like 9 of us, not having the same thing, but 9 patients that were in the holding recovery area that needed to go to a room, and there was not a room available. So I was in recovery from 11:30 on 11/20, the day of my surgery, until 11/21 the next day. That was a Thursday, around 3:30, 4 o'clock. Just because there was no room for me to go to. And I needed to go to a certain floor, so I'm sure that held it up a little bit longer. But I was well taken care of. The nurses in recovery area were great. I just really didn't get to get up and move around as much as I thought I would be able to, because I was in a recovery holding room area, and the patients were just separated by sheets and beds and like one chair. Then the first day, I was kind of nauseated, I'm not gonna lie, but they gave me Protonics for my stomach, and they gave me Zofran and even Vinegar, and so they kept the nausea, under control. The second day, I didn't have that. And I'm sure most of that was probably from the anesthesia, which I wasn't used to because I'd never been put under before. And I was able to, get up and move around once I got into a regular room. I didn't have bad gas pains like some people talk about on my chest, lots of pressure. I did burp some, but I wasn't, feeling like I was having chest pains or anything. The gas was so bad. I just didn't experience that. Some people do. I didn't. They had me on clear liquids the first day, and the second day. The third day is the day that I come home, which was Friday. They moved me from clear liquids to full liquids to see how I could tolerate that. And I've been on full liquids since I came home. The most pain I've had is on my right midsection to the middle of my side, like kind of in this area. And he said that was to be expected because that's where they did all the sewing back up. And plus I had a liver biopsy along with the gastric sleeve. And so there's a lot going on right there. I have 6 portholes. Some people have 3, some people have 5. I have 6. I'm special. I don't know. I was hoping I'd only have 3, but all of them are doing well. None of them hurt. They all look good. None of them are infected, or I'm not having any issues with that. There's one that's a little bit tender, and that's where they pulled the biopsy through and the excess stomach through. So that's to be expected also, because it's a little bigger and there was a lot going on there. Day 1 home from the hospital, I was glad they sent pain medicine, liquid pain medicine, home with me. Day 2, I was glad that they sent liquid pain medicine home with me because I took it and I slept a lot. The third day, I hurt, but not as bad. Each day it got a little bit better. It was really hard getting up from chairs and sitting down in chairs or from lower positions, because across, your stomach here is what you're using to get up and to move your abdomen, and it just really hurt. I could not lay flat in the bed. I wanted to sleep in my bed so bad, but I couldn't do it. I could not completely lay flat. And so I'm on day 7 today. It's been exactly a week, and I'm sleeping in the recliner still. I feel like over the next couple of days I might be able to go ahead and go to the bed, but it just hurts. So I'm not pushing it. I'd rather sleep in the recliner so it doesn't hurt. I've been able to tolerate my liquids. The nausea is gone. I'm not having any issues like that. I have a follow-up appointment on Monday the 2nd. It should have been tomorrow, but tomorrow is Thanksgiving, and you know, he's not in the office. So he's like, I'll see you Thursday. And I was like, Thursday's Thanksgiving. He's like, I won't see you Thursday. So we pushed it till Monday the 2nd. And I'm anxious to go in and talk to him and let him look at my ports and just talk to him about how I've been progressing. I haven't weighed. Actually, our scale broke, so I think that's probably a good thing because they pump you so full of fluids while you're in the hospital. Sometimes you can gain a little bit instead of losing it first. I don't know. My husband said my face looks different. Maybe. I don't know. I've mostly been concentrating on sipping my protein shakes because that's what he said. Get my protein in. So anywhere that I can get bone broth or protein shakes, I've been pushing those more. I need to push water more. But when he released me, he said concentrate on my protein because protein was important and it was going to be hard to get the protein in at first, and it has been. I need like 75 grams of protein a day. And yesterday I got 65, and that's the closest I've been. Like the other days it's been like 40, 45, and that's with me adding it to any, you know, even protein powder to stuff that I thought needed extra protein. The Premier protein shakes have been great. I've made a couple smoothies with like a chocolate one with a scoop of PB2 and a third of a banana, and had that, but it has to be thin, so you have to thin it out with almond milk or Fairlife milk so it's not so thick. At this stage it has to be thin liquids. I've had some cream soups, and I thinned them with bone broth, which has protein in it, to make, you know, to increase the amount of protein that I'm getting. It's just sip, sip, sip. Today I've been able to sip more water and more liquid. At first it was really hard, and so each day it's getting better. It's just a journey, and I'm stepping, you know, baby steps through it. One day I made applesauce with protein powder and added a little water to thin it out so I could eat with a spoon. It's all mental, you know. It just gave me something to eat other than something to drink, so that helped me out. And the potato soup I made was really good. I bought a can of Campbell's cream of potato soup, and I strained the pieces out and added bone broth to it, and it satisfied me other than having just a sweet drink. You know, just a sweet Premier protein shake or a Great Value protein shake, a chocolate. I found some coffee ones that are really good, and I've been working on that. But that's how things are going, and I just wanted you guys to know how it went at the hospital and how the surgery went, and I will touch base again after my pre-op follow-up appointment with Dr. Bilton and give you an update on what he says after I talk to him. And that will be into my 2nd week, so I'll probably wait till the end of the week so I can give you a report if he moves me to pureed stage or if I'm still going to be on full liquids. Hopefully he'll be moving me to pureed stage, and I can fool around with some different types of food and see how that goes. Thanks for watching. Bye.